Assalamu alaikum, doctors. Hello, everyone. I hope that you are fine and everything is okay with you. Um, let's start our session today, inshallah, and let's continue our curriculum and our course that we have started. Today, inshallah, will be the last free session in our course, and from tomorrow, all the candidates who have registered will be added to a private WhatsApp group. They will be given access to the drive, including all the materials in our course, listening, reading, writing, and speaking. They will have access to the platform on which the sessions are uploaded. All of our sessions are recorded, doctors, and you will be having access to them for complete and whole 6 months. All of the sessions are genuine and they are completely based on recalls only. And that's what we have started. We have started by giving you the free webinar orientation, and you can find that on the platform. We have given also an intro about what will the course include exactly, what will be the content of the course exactly, including everything, the recalls, the book of recalls. By the way, we are literally working on it. You can have a look at the interface, which gonna be something more than perfect. It's gonna be something like, a complete book of recalls, based only on the recalls. It's gonna include everything literally, like the topics that have appeared in the exam. It will include 8 full exams, 16 part A reading, 8 part A reading, 16 part C reading, 16 part A listening, and 16 part C listening as well. 8 letters and 16 speaking cards. That will be something unique, something that has never happened before. And all of the doctors involved in the course will have the priority to get this book of recalls with a huge discount, inshallah. Okay, let's continue what we have started the previous time, our last session, which was about the writing. We have started with the writing, we have started with the routine referral, and we have started with this letter, Miss Sarah Miller, which was about routine referral. Just a quick brief or a quick summary about what we have discussed already. We have talked about how to approach the case notes, what to do exactly in the 5 minutes. Our main aim, as we have agreed the previous session, was the 5 minutes. I should make use of every second in the 5 minutes of preparation in the OET, in the writing subtest. And we have agreed that we should start from the writing task. We should start from the writing task. Okay, including what? Including the part of the referral. So from this part, we have known that I should do a routine referral. We have agreed that if he wants me to do an urgent referral, he will tell me that. If he wants me to do something like discharge, he will tell me that. And at the same time, I knew from this writing task that I'm referring the patient to a dermatologist. And I've known what? I have known the purpose. What is the purpose of my letter? It's assessment and management. In every single letter, doctors, in every single case notes, you will find the request. What is the request here? It's assessment and management. Assessment and management. Okay? This is regarding the request or the purpose in our writing task. And also we have known about the diagnosis. So we have here severe acne and possible rosacea, and we have known the address. And we will know today how to make use of this address of the specialist. Very important in the layout. And after that, we have agreed that if not everything is provided in the writing task, you can find it in the plan, which can carry the name of what? It can carry the name of preliminary diagnosis, provisional diagnosis, confirmatory diagnosis, or even diagnosis only. All of those can include maybe the request or the diagnosis. as you can see here. And after we finished this part, what I'm doing now is just a brief summary of what we have talked about and what we have discussed in the previous session. After that, we are going to start the case notes from the beginning. So I'm having here the name of the patient, which is completely relevant. We have agreed the previous time that I'm either determining whether this information is relevant or irrelevant or semi-relevant, whether it's relevant or semi-relevant or irrelevant. So if the information in this letter is important, if I ask myself, does the consultant need to know this information? It will be relevant, so I will put a tick here. If I ask myself and found that the information is not relevant, it's irrelevant. I mean, the consultant will not need this information. As we have agreed, maybe something here like the hobbies. I'm referring to a dermatologist for a patient who is having acne and rosacea. And this has nothing to do with the swimming or the hiking. So, this information is what is irrelevant. And maybe we are having some other things called semi-relevant. And we have agreed that the semi-relevant information can be included or excluded depending on what, doctor? Depending on the size of the case notes. The size of the case notes. So, I think you haven't imagined what do I mean by the size of the case notes. So let's give you an example here. By the way, this is a complete case note and as well, it's part of the recalls. This will be provided as well among the materials that you will get access to. So we are having here a letter for a patient called James Seymour. This patient is having gout. Okay? And I'm referring him to a rheumatologist. What do I mean by a long letter? If you have a look here, doctor, at the second paper, I mean this whole paper, when you just go through the case notes, when you start reading them, you will find nothing irrelevant here. Nothing irrelevant. Everything here is talking about the attack of gout, is describing the attack of gout, whether in this visit or in today's visit. So all of that cannot be irrelevant. They are either relevant or semi-relevant. What if, doctor, you decided to write every single piece of information in these two visits? What if you decide to do that? Believe me, doctor, I swear you will not finish the letter in the exam. You will never be able to finish the letter whether you are having a paper-based or computer-based in the exam within 40 minutes. You will never do that. That's tons of information, doctor, and you don't need to write all of that. And that's the size of the case notes in which you must stop and say, oh, I will not write the semi-relevant information here. I will not write that. For example, you are telling the consultant that you advised the patient to stop the medication if he develops GIT symptoms. Any medication in the world can have side effects or GIT side effects. I mean, any medication can cause nausea, diarrhea, maybe anything, right? So you don't need to mention this to the specialist. Can I consider this piece of information as irrelevant? Of course not. This is not irrelevant. However, it's semi-relevant. You don't need to mention this piece of information. If you mention that, you are wasting your time. You are wasting the specialist's time. Everyone, every doctor in the world knows that the medication may have some GIT upset or may cause some GIT upset. It's fine. Why are you mentioning this piece of information, doctor? So I don't need to do that. Can I call it irrelevant? No, I can't call it irrelevant. However, it's semi-relevant. And in a long case notes like this one, you can't mention the semi-relevant information. You will not be able to finish the letter, and the word count will be too much, and you will lose lots of marks, either from the content, either from wasting your time. You will not be able to finish the letter and then you got stuck. So please, in the long letters, doctor, don't include the semi-relevant information. Okay? This is very important, doctors. Okay, so if we get back to our letter, we have talked about the occupation and the date of birth, and we are going to discuss how to make use of this. We have talked about we have talked about the special habits, and we have said that smoking and drinking are almost always relevant in all types of letters. This is relevant in all types of letter. Believe me, doctor, smoking and drinking are nearly 100% related to any medical condition. So please always include them. Okay? In this letter, the hobbies are not relevant. You don't need to mention that. We have agreed that if the disease was not acne, if it was something else, like pityriasis versicolor, a dermatological condition which can be caused by swimming or hot weather and so on, you can mention the swimming. But with acne and rosacea, you don't need to mention swimming. Okay, regarding the family history, we have agreed that I can involve that the mother is having adult acne, but you don't need to mention the hypertension in the father or on the father's side because hypertension is not related to acne by any means. And in the medical history, you can involve the childhood eczema and the hay fever, considering that they are related to dermatology generally, and some other doctors may choose, no, doctor, I will not say that. By the way, both of them are correct. How? The doctors who want to involve the eczema and the hay fever are thinking that they are related to dermatological conditions, they are related to dermatology, so I want to tell the consultant that the patient was having childhood eczema. But some other doctors may say, I will not involve the eczema or the hay fever. And when you ask them, why, doctors, you are not going to include that? Because this will not affect the consultant's treatment plan. This will not affect the consultant management plan. So there is no need at all to mention that. So both of them are correct, by the way. This piece of information is semi-relevant and you can either include it or exclude it. And the last thing we have talked about the previous session was what? The allergy. Can you remember, doctors? If anyone has missed the previous sessions, you can find them, doctors, on the links that we have posted everywhere and also on the platform. You can have this demo on the platform of Fame. So we have talked in detail about when to include the allergies and when to exclude them. In some cases, we might need to include allergies like a condition of eczema, asthma, immunological disorders, and in some other condition, you don't need to mention the allergies like diabetes, hypertension, ischemic heart disease. You don't need to mention that unless the patient is allergic to a specific medication related to the medical condition. What if the patient is having diabetes and he is having allergy to rapid acting insulin? Some type of rapid acting insulin or short acting insulin, then you need to mention that. Okay, that was the part that we stopped at the previous session. Let's continue, doctors. After finishing this part, what you should look at is what? Is the time frame, the timeline. Doctor, what do you mean by time frame or timeline? What do you mean by time frame or timeline? I mean, doctor, you must determine along which or what is the time frame that the patient is presenting with the symptoms across. I mean, how long have the symptoms persisted till now? How long have the symptoms persisted? Here, doctor, the condition started on 15th of September 2023. And after that, you are having 13th of October. And after that, you are having 20th of November. And then 1st of January. So we are talking about a time frame from maybe 15th of September till, if we can have a look here, till what? Till 1st of January. We are talking about 3 months, maybe 3 months, right? Or 3.5 months. It's fine to say 3 months. So the time frame is very important, doctors. Why? Because you must know when did the condition start and what is today's visit. What is today's date? Doctor, you are telling me that this letter is from the recalls, and you mentioned that it appeared about several days ago. So, how are you writing here 1st of January? Yes, doctor. We will know that in all types of case notes now in the exams of OET, there is some sentence written here, which is called assume that today's date is, mostly it will be 8th of January 2024, and sometimes they bring 1st of January 2024. Doctor, will this happen in the exam? Yes, 100%, doctor. 100%. You will enter the exam and find this sentence in the case notes. So what does he mean by that? He mean that today's date or today's visit will be 8th of January 2024. Okay, in the past, doctors, about 2 or 3 years ago, they used to bring today's date like the date of your exam. So if some doctor is having his exam on 15th of April, he will find that today's date is what? 15th of April. And they used to bring that. However, this started about 2 years ago. By bringing this sentence, assume that today's date is, and he gives you the date, mostly it's 8th of January 2024, and this is the same date that you will find in what? In today's visit. Whether 8th of January or 1st of January, one of them you will find it. Okay, so just expect that the previous visits or the previous dates will be before 2024, maybe 2023, 2022, 2021, and so on. Okay, mostly doctors, you will find something related to that. Okay, this is perfect. So the first thing, doctor, in knowing the previous visits or knowing the time frame is to know when did the condition start and what is today's visit. So what if you want to start with telling the consultant that the condition started on 15th of September? Yes, I can say that. I can say later on, we will know that inshallah, by saying something like Miss Miller initially presented on 15th of September with 1, 2, 3. Or you can say Miss Miller presented 3 months ago with 1, 2, 3. So, do you know now, doctor, the importance of the time frame? The date of the visit is very important to frame out, to lay out the time frame for the consultant. Because in some case notes, and by the way, this happened, doctor, very recently. They brought a letter with a patient having morbid obesity, and you are referring this patient to bariatric surgery. Do you know, doctor, the number of visits in the case notes? Can you imagine? The number of the visits in the case notes were 8 visits. 8 visits, doctor. There were 8 dates in the exam. Do you think that you will include, doctor, every single visit and transform this into a paragraph in the exam? Of course not, doctor. This can happen in some types of letters. If you are having a short letter or maybe an average one, by the way, this letter is an average one. It cannot be considered a very long letter at all. If you are having this one, if you are having two visits in the exam or three visits in the exam, you can write a paragraph corresponding to each visit. It's fine. But can you imagine, doctor, that if you are having five or six visits, you are going to write a paragraph corresponding to each visit? This will never happen, doctor. Can you write in the exam six or seven paragraphs? No, doctor. Doctor, believe me, please. You are having here the introduction. You are having here the closure. The body of the letter in the exam will be from or within 3 to 5 paragraphs. Usually 3 or 4 maximum. Maximum, doctor. Please don't involve more than that. Doctor, if I involve more than that, is there a rule that this will be wrong? No, doctor, there is no rule for that. However, never do that, please. Let the maximum number of paragraphs in the exam be 1, 2, 3, 4, and the maximum is 5. Of course, definitely, I mean for the body of the letter. So I'm having the intro, I'm having the closure, and between them, doctor, don't include more than 3 or 4 paragraphs. That's more than enough. So, of course, definitely, if you are having 5, 6, 7 visits, you are going to do what? You are going to summarize them. You are going to paraphrase them. You are going to do what we call grouping. Doctor, you mean that I can mix some visits in the exam together in one paragraph? Yes, doctor, you can do that. And you should do that in case of many visits in the exam. Yes, you can group, you can mix two visits together in the exam. Okay? And we will know that in details, inshallah, while going through the course. Yes, you can mix those two visits by saying something like, on the following visits. So you will start with the initial visit, and after that, how to express things in two different dates. I can say something like, and we will know many ways. One of them is on the following visits, and then mix them together. Mix the subjective or the symptoms together, the signs together, and if we are having management together. I'm just telling you, doctor, from the previous session, don't think that the consultant is just sitting at his desk, maybe, or in the clinic, waiting for you to tell him that, oh, on 13th of October, Miss Miller presented with persistent acne, with burning sensation. There was no improvement. And her examination showed increased redness, pustules on the chin and nose, dry, flaky skin, and the management was 1, 2, 3. And on 20th of November, Miss Miller presented with minimal improvement. She reported frequent facial flushing, especially after hot drinks. And she had moderate cystic acne, persistent background redness on the cheeks, and fine telangiectasia. And she was diagnosed with refractory acne vulgaris. And she was commented, no, doctor. Doctor, he is not waiting you to tell him every single piece of information in each visit. He doesn't need to know that. If you understand, doctor, the moral, the core of writing in OET, you will understand what to do exactly, how to tackle things. It's not about who write more than the other. No, it's about what to write, what to include. So I must understand and I must know that The consultant is not waiting to know the subjective, the objective, the management in each visit. No, no, doctor. He's not waiting for that. He just wants to know when did the condition start and how did it start? Yes, of course, definitely this is important. And he wants to know what happened today. Doctor, from all what I have mentioned, please write in the chat box. What is the most important visit in any letter, any type of letter? Any type of letter, doctor. Routine referral, urgent referral, discharge, transfer letter. Write in the chat box, please. What is the most important visit overall, doctor? What is the most important visit, doctor? Can anyone tell me, please? What is the most important visit that you must include? And if you don't include anything from it, of course you will lose marks. 100%. Perfect. Perfect, Dr. Hannah and Dr. Aisha. Yes, yes, exactly. Yes, it's today's visit, the last visit. This is the most important visit, doctor, in the whole letter. Doctor, if you miss a single piece of information in today's visit, you will lose marks. Do you know why? Can you imagine, doctor? Can you imagine that there might be some information in today's visit that can be considered irrelevant? 100% no. Every single piece of information in today's visit will be what? Will be relevant. Relevant. All of today's visit, regardless the type of the letter, a routine referral, an urgent referral, a discharge letter, a transfer letter, a refer to another GP, referral to non-medical profession. Those are the types that we discussed in our first sessions, right? In all types of letters, today's visit is the most important visit ever. Do you know why? Because this is the visit, doctor, that you decided to do what? You decided to refer the patient to the specialist. In the last visit or in today's visit, you have decided to take an action and say, please stop. I can't treat this patient anymore as a GP. I need to refer the patient to the specialist. And you took the action and referred him to the dermatologist. Doctor, you can find any other letter. If you have a look at any other letter, this letter, Mr. James Seymour, who is having gout, he was diagnosed here with gout, and you decided to refer him to the rheumatologist from today's visit. Any other letter, doctor, bring any other letter you can imagine. This patient is having type 2 diabetes. You decided to take an action and refer him to the endocrinologist. Where? In today's visit. So today's visit is the most important visit ever. And I always keep telling doctors and candidates, if you include today's visit completely right, with some other things in the letter that must be written as well, you passed the writing subtest, doctor. And that's why, Alhamdulillah, all of our candidates usually get grade B. Even those, by the way, who are aiming for ESEF MG certification after USMLE in the United States, they get grade B in writing, not C plus only. Okay, very important. Okay, let's go back to our letter and let's have a look. So you will find in 15th of September 2023 that I'm having subjective. Okay, I'm having subjective. Subjective, doctors, in the letter means symptoms. Subjective means symptoms. Okay, and I'm having objective. Objective means signs or examination. So it's not a must that he brings to you in any visit saying symptoms and signs. No, he may bring subjective and objective. In subjective, you find complain of. CO means complain of persistent facial breakouts, mainly on the cheek and forehead, and this has been going on for 6 months. And the patient used OTC. What do we mean by OTC? Over the counter. Over the counter. Those are medications that don't need any prescription. Over the counter facial scrubs and washes with no success. Reports that the skin feels tight and itchy. In the signs, you found inflammatory papules and closed comedones on bilateral cheeks, mild erythema, and those are the vital signs. As you can see, doctor, the vital signs are normal. And by the way, this has an indication, this has a significance, but later on we will know that. Okay, the temperature here is normal, the pulse is normal, and the blood pressure is normal. Okay, so in this visit, you decided to give the patient some treatment called topical benzoyl peroxide 5% gel, and you advised her on gentle cleansing and review or to be reviewed in 4 weeks. And after that, the patient presented on 13th of October, saying that the acne persists, and she reported burning sensation after applying topical gel. There was no improvement or significant improvement in the skin clarity. Okay, she was self-conscious at work. This is fine. And on the signs, there was increased redness or erythema and pustules on the chin and nose and dry flaky skin. So you decided to do what? You decided to stop the benzoyl peroxide because it has appeared not to be efficient and to start topical clindamycin, 1% twice daily, and to review the patient in 6 weeks. Okay, and after that, the patient presented before the 6 weeks passed. We were in 13th of October and she re-presented again on 20th of November. She said that, doctor, I had minimal improvement in acne and I'm having something new, which is what? Frequent facial flushing, especially after hot drinks or exercise. This is the main sign of what, doctor? Doctors who love dermatology, yes, rosacea. Rosacea are or is triggered by by hot drinks or exercise. So on examination, you found moderate cystic acne and redness on the cheeks and nose and fine telangiectasia on the nasal alveoli. And then you diagnosed her with refractory acne vulgaris. Why refractory? It's not responding to the treatment, so it's called the refractory. And you started her on some management called oral limecycline for 108 mg daily, and she was advised on some protection. Perfect. And after that, on today's visit, the patient is distressed. Doctor, the acne is worsening. I'm having stinging and flushing. I need a specialist intervention, please. And on examination, you found again cystic acne with scarring, facial erythema and papulopustular lesions, and rosacea overlap. So you decided to refer her to a dermatologist for management of severe acne and the investigation of rosacea. So from these doctor, if you can decide, by the way, all of that doctors, we are where in the letter? We are in this part. Doctor, you mean we are in the reading time 5 minutes? Yes, we are still in the 5 minutes of reading time. Oh, doctor, it took us about 2 sessions to tell us about that. Will I have time in the exam to do that? Yes, definitely, doctor. With practice, doctor, and after getting familiar with different topics, because by the way, the letters, the topics are always repeated in the exams. As I told you, referral to dermatology has been repeated about 5 or 6 times during February, and so on. So, with getting familiar or after getting familiar with the topics, you will be able, doctor, to do this in 5 minutes. What do I need to do? You need to determine the relevant and the irrelevant, and you need to determine even mentally before holding your pencil what shall I do? Or what shall I write exactly in my letter? Oh, okay. I will write one paragraph to talk about the initial visit. I can even decide to mix with it the second visit by saying that the condition persisted and did not improve, so benzoyl peroxide was replaced by topical clindamycin. And I can write a paragraph about this one and a paragraph, of course, definitely about today's visit. So I'm going to write three paragraphs in addition to what? In addition to this paragraph. Please, doctor, don't forget it. Smoking and drinking, and if you want to mention the eczema and so on. Some other doctor may say no. I will not mix or combine the initial visit with the following visit. So what will you do, doctor? I will mention this visit in a separate paragraph, and after that, I will mention or combine those two visits together. I will mention the second visit with the third visit together in one paragraph by saying on the following visit the condition did not improve, and 1, 2, 3, 4, and then I will write today's visit in a separate paragraph. Doctor, do you mean that today's visit in any type of letter will be written as a separate paragraph? Yes, 100% doctor, this is recommended. In 99.9 letters in the exam, write today's visit, please doctor, in a separate paragraph. Doctor, please don't mix or combine today's visit with any other visit in the exam. Unless I told you 99.9, right? There is 0.1%. In some types of letters, doctor, you will not find any information in today's visit. You will not find information in today's visit. How come, doctor? How can I meet or face a case notes in which there's no information in today? Yes. In some letters, doctor, you will find only in today's visit the result of an investigation. Something saying, for example, condition, same, and MRI confirmed diagnosis. That's it. In some types of letters, doctor, you will find this only in today's visit. Can you form a complete paragraph, a complete separate paragraph by mentioning only that the condition persisted and the MRI confirmed the diagnosis? Doctor, this information cannot form a sentence, cannot form a line. You cannot make a paragraph with one line only. Then you will need to combine this information or add this information to the previous visit. Yes. Again, doctor, in 99.9, you will write today's visit in a separate paragraph, and that's it. Okay? However, however, in 0.1% of the letters, you will find that today's visit does not include any information. It has nothing to do or to write a complete paragraph with. Then you can take this piece of information and add it to the previous visit. And this only example, okay, will be the only thing that or in which you will add or combine today's visit to the previous visit. Otherwise, you will write today's visit as a separate paragraph. Look here, doctor, in this letter, today's visit can form a separate paragraph. Any letter. Look here, doctor, today's visit can write a separate paragraph or can form a separate paragraph. Okay, this letter includes only or consists only of one letter. Sorry, one visit. So it will be divided into many paragraphs. And this is one thing. You know that, doctor? You know, doctor, that in some types of letters you will only have one visit? Oh, so if someone is not flexible, he will say, Doctor, I will need to write the whole letter in one paragraph only representing today's visit. No, doctor. In this type, you can divide. You can what? You can divide the visit into many paragraphs, like paragraph speaking about the symptoms, another paragraph speaking or talking about the examination, another paragraph talking about the medications, and one, for example, maybe for the special habits and so on. Oh, you mean that in some types of letters in which we are having one visit only or two visits only, I can divide the paragraph or the visit into smaller paragraphs. Yes. Doctor, there is no rule for that. What I need you to know, please, there is no rule for that. You are the only one. You are the only one um, who can who can determine the number of paragraphs in the case notes or in the letter. You can decide, oh, I will write this letter in two paragraphs. I will write this letter into three paragraphs. Okay, of course, definitely apart from the intro and closure. You are the only one who can do that. Some doctor may choose to write each paragraph corresponding to a visit. Some other one will say, I will mix initial visit and the next paragraph together, or the next visit together in one paragraph. Some other doctor may say, I will mix the two visits in the middle together, and I will write the initial visit alone and today's visit alone. Sorry, this is today's visit. And I will mix or combine the two visits in the middle together. You are the one who can determine that, doctor. Believe me. Okay, perfect. Let's take some other thing related to starting the letter. Doctor, we have decided in the 5 minutes what to include, what to write exactly, what should be involved or included, and what should be excluded. And then, after the 5 minutes, when he says to you, please hold your pencil, if you are having a paper paste, you should hold your pencil to do this sign beside the relevant, this sign beside the irrelevant, and the dash beside the semi-relevant. You can do that in the first 2 minutes from the 40 minutes. Doctor, what if I'm having a computer-based exam? In the computer-based, you are not able to do these signs. So what should I do, please? You can do highlighting. Yes, in the exam, in the computer-based, you are able to highlight. So you can do this. You can highlight only the relevant information and leave the other ones. So here the name is relevant, the date of birth is relevant. I'm gonna mention the occupation, I'm gonna mention the special habits, for example, the family history with the adult acne, the medical history, and so on. Yes, you can do that, doctor, in the computer based. Perfect. Okay, so now I'm gonna start writing my letter, and today we will be taking some part of the layout so as to be continued later on, inshallah, which is the address. I'm gonna talk about the address and the date. Okay, so first of all, the address. Where to bring the address from, doctor? How can I have the address to write? In this part, doctor, in the writing task, as we have agreed, you will find the address. Write the letter to Dr. Helena Vance, dermatologist, Skin Health Clinic, 45 Central Avenue, a Newtown. This is my address. So what I should do now is to take that and write here in the upper left part of my paper or the Word file, if I'm having a computer-based one, and write Dr. Helena Vance, dermatologist, Skin Healthy Clinic, 45 Central Avenue, a Newtown. Doctor, you are just doing copy and paste. That's it. In the computer-based exam, in some centers, not all centers, you are able to do copy and paste. But you can do that and do copy text. Yes, in some exams you can do that. But please, I'm just always telling the candidates to be ready for the challenging situations or ready for difficult situations. So let's assume that you are not able to do copy and paste. Then you are gonna write. You will be writing here, okay, the address, Dr. Helena Vance, below it, dermatologist, the specialty, and after that, the rest of address. I need you, doctor, to notice here two things, please. The first thing, in the writing task, we are having what? We are having this comma between each name and the other. This comma, this comma, this comma, and so on. You are having these commas, doctor, between each name and the other. Um, what did we do, doctor? What did we do when we are writing the address? There are no commas here. No punctuation is written in the address. No comma and no full stop. We are just taking the name only. So Dr. Helena Vance, and with each comma, you go a line below. So he gave me Dr. Helena Vance, and then he put comma. With each comma, you go down below. Dermatologist. And after dermatologist, there was a comma, and then you go a line below. Skin Healthy Clinic, and so on. So please write in your notebook. Rule number one, there is no punctuation at all in the address, doctor. No punctuation at all in the address. Please know that. Perfect. Okay. Number two, have you noticed, doctor, that each name here, each name starts with capital letter? Doctor, D capital, Helena, H capital, and Vance, V capital. And then dermatologist, D capital. And then skin health clinic, S capital, H capital, and C capital. Central Avenue, C capital and A capital. A new town, N capital. And this is exactly what I did, doctor, in the answer sheet. The capital letters must be maintained as capital when you write the address, doctor. S capital, H capital, C capital, C capital, A capital, and then N capital. With any name he is giving you, doctor, you must write it in capital. Not only names. For example, in the address he gave you the specialty with D capital. Then you must write it D capital. Doctor, if you just neglect that and draw dermatologist with D small, you will lose marks. The address, each name in the address, each word in the address must start with capital letter. This is very important, doctor. So don't write small letters, please, with the first or at the start of every word. Don't write a small letter here. If you do that, you will lose marks because you will find in the address that each name starts or each word starts with a capital letter. And number two, don't use punctuation. No commas or full stop in the address. Okay? And again, doctor, in 99% of the letters, you will find the specialty just below the specialist name or the consultant name, like here. Sorry, we can just remove this one now. Okay, In 99%, you will find dermatologist or the specialty just after the name of the consultant. What if I didn't find that? Can they bring the name of the consultant without the specialty? Sometimes, doctor, they bring the specialty within the letter itself, not in the writing task. So you can see, for example, here in the plan, he wrote dermatologist. What if he didn't mention here dermatologist? He mentioned Dr. Helena Vance, Skin Health Clinic. Can I write dermatologist in the address? Yes, doctor, you can do that. So if the specialty is not written in the writing task and it's written anywhere else in the case notes, you can take this specialty, doctor, and write it in the address. It's completely fine. It's completely fine. But there are some other situations in which he may not bring the name of the consultant. He may not bring the name of the consultant. What will happen? What will be the results? We will be discussing that later, inshallah. But till now, if he doesn't bring to you the specialty and it was written anywhere in the letter, definitely you can write it below the name. Some doctor is asking, do we need to put this dot? If we can just do some zooming here, can or do we need or must we put this dot after doctor or Mr. or Miss? No, doctor. You don't need to do that. You can write direct away, Dr. Helena Vance. Yes, you can do that, doctor. It's fine. It's not a must, doctor, that you put a full stop after doctor or Mr. and so on. It's not a must. You can write doctor direct away. Okay, so here you can see, for example, Miss Sarah Miller. We have put a dot here after Miss, but you can write Miss Sarah Miller direct away. We don't need to put a dot here after Miss. It's fine. Okay, let's talk now about the date. What is that? What happened here, doctors? We have just finished the address. What happened here? What happened here, doctor, is that the address will be separated, or the date, sorry, will be separated from the address and what we call the salutation by space. So I have finished the address now. I have finished the address, right? Let's see, Dr. Helena Vance, dermatologist, skin health clinic, 45 Central Avenue, Newtown. Okay? And then you will need to leave a space. And by space, I mean on computer-based exams or in computer-based exams, it's to enter on the keyboard. To enter. This is one enter. This is to enter. And then write the date and then leave a space as well. What do we mean by space? To enter on the keyboard. And then write Dear Dr. Vance, the salutation, and so on. So, doctor, this is a rule. The date is the only thing which is separated by a space above and a space below. In the address, within the address itself, you don't leave spaces, only one enter and you write. And here, when we see later on, inshallah, with the salutation and regarding, there is no space. Please be careful, doctor, because there are some old-fashioned modules. There are old-fashioned modules in which there is a space between the salutation and regarding. This is not totally true, doctor. Don't leave a space, please, between the salutation and regarding. The only part of the layout, in the layout, I mean this part. The only part in the layout in which there is a space is above the date and below the date. Doctor, from where Did I get the date? What is the date exactly? I have told you, doctor. The date is what? The date is today's date. So this date, you will just take, copy and paste in the answer sheet. And this date will be the same date that he will write a sentence with here saying, assume that today's date is 123. So you will just take this date and do copy and paste here. This is our date, doctor. Okay? Perfect. And then you will leave a space here and then you will write, Dear Dr. Vance. This is what we call what? This is what we call salutation. This is what we call salutation. Like, doctor, this is greeting. Salutation. You are saluting him by saying, Dear Doctor, and then use what? The last name of the specialist. This is Dr. Helena Vance, the full name of the specialist. But when you are going to address her, you are going to say or use the last name only. Dear Dr. Vance. And we will know later, inshallah. Doctors, please don't worry. We are going to take maybe 1 or 1.5 hour completely for the layout only. I'm just giving you an intro about the layout. So, Vance, here you used the last name of the specialist, Dear Dr. Vance. You don't say, Dear Dr. Helena Vance. No, you are not using the full name of the specialist, doctor. You will be using the last name of the specialist only. And by the way, the same for the patient. If you can see here, doctor, regarding Miss Sarah Miller, right? You used the full name of the patient. But when you are going to address the patient in the letter, you will be writing Miss Miller. And here again, Miss Miller, and so on. So please write in your notebook. In the address, you write the full name of the specialist. But in the salutation, we write the last name only. In regarding, RE doctors mean regarding. It means that I must write the name of the patient I'm talking about. It's called regarding. I just wrote here the full name of the patient, and when I'm going to address the patient, I will write the last name only. Okay, this is very important, doctors. So, what is RE as we said? It is called regarding, but we usually refer to it as RE, all of them capital, or R capital E small. Both of them, doctor, both of them are correct. So you can write R capital E capital or R capital E small regarding Miss Sarah Miller. And on the same line at the right, you will write DOB. What do we mean by DOB? Date of birth. DOB means date of birth, but we are going to write DOB. Okay, all of the letters must be capital. D capital, O capital, and B capital. And then you will write the date of birth. From where can I get the date of birth? From where, doctor? It can be written here in the case notes. So you are going to write 22/04/1998. Okay? Again, doctor. Again, doctor. So we have written the address, and then we left a space and wrote the date, and then we left a space and wrote the salutation, which is Dear Doctor, and the last name of the specialist. And this salutation is followed by comma. Yes, this salutation is followed by comma. And below the salutation direct away without leaving any space, we wrote regarding Miss Sarah Miller. Regarding, and then we put two dots, which is called colon. We will explain that in details, doctor, later on, inshallah, in our course. Okay, regarding two dots above each other, which is called colon, Miss Sarah Miller. And on the same line, at the right, I wrote DOB and then colon and wrote the DOB. Doctor, is this dot after doctor or miss? Is it a must? No, doctor. You can just neglect it. You don't need to write dot after doctor or dot after miss. By the way, doctor, even the comma after the salutation is optional. Oh, you mean that I can write Dear Dr. Vance like this without comma? Yes, you can do that, doctor. The comma after the salutation is optional. It's not a must, doctor. You are not obligated to use this comma. Okay, of course, the layout is not like this simple. I mean, there are some variations, right? And that we will be discussing inshallah later on. Maybe the consultant's name is not found. Maybe the date format is different from the date of birth. And we will know later on to make the letter having a consistent layout, the format of the date must be united, must be identical. I mean, I can't write in the date like January, like this, and then in the date of birth, I write the date with a slash. I can't do that in the letter. Doctor, what if you are referring the patient not to a consultant? You are referring the patient to a nurse or occupational therapist. You will not give him the title of consultant or doctor. You will not do that. We will learn what shall we do. Okay, what if you are referring the patient to someone who is called admitting officer? Who is that and what should we say exactly? We will know that, doctor. What if the patient is not an adult? What if the patient is not an adult? The patient can be a child. We will know what is the child exactly and what can differ or what can be different in our letter. In the regarding part and in the letter itself, what can happen. And we will know later that this layout is related to what? The part down below, which is called yours sincerely and doctor. So when to write yours sincerely, when to write yours faithfully, and what to write exactly, we will know that in details, doctor. So don't worry, we are going to discuss the layout in details. I usually give the layout to doctors in about 1 or 1.5 hours. So, because it's a very important part, as I always tell the doctors, if you guarantee doctors to have the full mark in the layout, the full mark in the layout, and if you succeeded to write the intro in a perfect manner and today's visit in a perfect manner completely, you have done it, doctor. You have done it and you passed the writing. Doctor, no one can get grade B in the writing without having the full mark in the layout and in the intro and closure. If you have any single mistake in them, doctor, it will be very difficult for you to pass the writing subtest. No one literally can have any single mistake in those parts and then he is aiming for grade B. And of course, I think some of you are targeting or aiming for the pathway of FY2 standalone in the UK. This pathway is demanding 400 plus in the OET in all subtests. So you must know, doctor, how to get the full mark in every single part of the OET, in the writing, of course, and then at the end, you will be able to do it. Okay, there is a question. Can we write the date of birth in the next line? Yes, doctor. Yes, definitely. We are going to talk about that also later. There is no need or it's not a must to write the date of birth on the same line. You can write it in the line below the regarding. Yes, definitely you can do that. Okay, thank you so much, doctors, for attending today. This is the end of our session.